We are shifting gears now, though, and talking about some other numbers that have been released, and it has to do with the use of drugs like Ozempic and drugs including Ozempic that, as you likely know, were brought out as drugs for people with diabetes, but have been widely used as weight loss drugs.
So I went to the doctor. I did a full blood panel. I had my cholesterol was high. I have zero testosterone. I was pre-diabetic. She actually said, why don't you do a semaglutide, Ozempic? So I did. I did that in December.
That was Emily Simpson. She is better known as one of the Real Housewives of the OC, and she was speaking on Jeff Lewis Live on Sirius XM. But it is more widespread than that. And joining me to talk more about these numbers is Tom Elliott, the medical director of BC Diabetes. Tom Elliott, thank you so much for being with us.
Oh, thanks, Jill. It's great to be on your show again.
Well, some new numbers that were put out showing a big increase in the number of people that are using Ozempic in BC, really having gone up from, I think it was around, it was much less in 2021 and up to huge numbers looking at 2023 and 2024. What are you seeing as far as Ozempic being used?
Well, Jill, firstly, I'm not surprised to hear that more people are using these drugs because they're extremely effective for weight loss, and overweight is common. In my daily practice, I run a diabetes clinic where in almost all cases we're prescribing it for type 2 diabetes and now also for type 1. And because the drug is so very useful for people who are overweight with type 1 or with type 2 or type 1 diabetes, we continue to prescribe it frequently.
Oh, right. And the numbers, again, so the number of people using it. So I'm looking back, it was about 41,000 people in BC back in 2021. It's now at about 113,000 at this point, the end of August 2024. Are you, with that, do you think, though, is it the majority? Is it people that have either type 1 or type 2 diabetes, or is it also being prescribed more and being used by people whose main concern is weight loss?
I can't answer that question. Pharmacare and PharmaNet, which tracks all the prescriptions, would be able to answer that question, although, of course, it would involve invasion of privacy, so they're not going to. What has happened in the last 6 months, Jill, is that the active drug in Ozempic called semaglutide is now approved for overweight, and it is branded as Wegovy. So I'm not sure if you're quoting Wegovy and Ozempic, but I mean it until 6 months ago it wasn't listed as a treatment for people without diabetes, but now it is. It does have that indication. So it's respectable, and there are no. I think what I want to say is that there's no shame in being on these drugs if you are obese or overweight and you've tried hard to lose weight with lifestyle. The drugs are very effective, and so I think we're going to see more and more prescription of these drugs. The price is going to come down with competition. There's another drug called Mounjaro from Eli Lilly, which is even more powerful than Ozempic or Wegovy. So, yes, I think we're going to see more and more of these drugs being used.
Something you just said there, though, that they are very effective and being used and now being prescribed for people who have maybe tried to lose weight and haven't, and then go on these drugs. Is there a concern, or does it matter if you have tried more traditional ways of losing weight before going on the drugs, or are you going to see people kind of leapfrogging over that and going straight to the drugs?
You're definitely going to see people going straight to the drugs because it works. It works no matter what you eat. You end up eating less, you feel full, and so the drug causes weight loss. But, I mean, that's not I wouldn't say that's a healthy approach to weight loss. We should all try our best to have healthy eating habits, eating at meal times, not eating when we're sad, tired, lonely, bored, or anxious. We put food ideally the food goes on the plate, and when the plate's empty, you push away from the table. Of course, that's not the way many of us eat, particularly in the summer when parties abound. Yes, lifestyle therapy is first, second, and third always.
Right. Okay. When somebody goes on one of these drugs, though, and like you said, it makes you feel full. It is very effective in helping people lose weight. Do you have to stay on it indefinitely?
Well, if you want to maintain whatever weight loss you've achieved, you will be faced with, feeling hungry and having to have the willpower to say no. So, and of course, most people are not capable of that. So I think the message to your listeners is that if you lose a bunch of weight with one of these drugs and stop it, you're going to be hard-pressed not to regain that weight.
Right, which is also true of like you said, of being mindful of what you're eating and how much you're eating. That if you stop doing that and go kind of revert to old bad habits, that's bound to happen as well. So is there enough, do you think, or is this something that's being worked into other lifestyle changes, and that is one kind of tool that's being used, but not the only thing that's necessary?
Well, Jill, I'm also involved with a wonderful companion clinic called Lifestyle RX. And Lifestyle RX is a clinic run by family doctors. It's online and it's free to every British Columbian. And it's a 12-week course that digs down on lifestyle. I'm not just eating less and exercising more. It talks about types of food. It talks about sleep hygiene. It talks about sustainable exercise. So I would encourage, all your listeners to attend to those things. And if they're interested, sign up at Lifestyle RX. It's as long as you have coverage through BC Medical, it's free to British Columbians.
Interesting. I would imagine that could be quite the eye opener, even if somebody thinks that they're being pretty healthy and trying to stick to a healthy diet. Having to write it down and be accountable to it might show you things that you might not want to see.
Yes, I'm surprised by the results I hear. I have patients who've been there who've been able to stop their insulin. I thought I was doing a good job just with my stuff, but no, it definitely offers something additional.
And just going back to something you mentioned as well, because we are, again, talking about this because of the popularity of the use of these drugs, not only in BC, but in a lot of different places. You mentioned, again, how it makes you feel full, and that's one of the main things, how these drugs really do help people lose weight. Is there a concern, though, that yes, you feel full, but maybe it doesn't make you really have to focus on what you are eating or making sure you're getting all of the right nutrients and things if maybe you're eating foods that aren't the best for you, but you still feel full, so you're losing weight?
Well, I mean, you ask a really good question, Jill. I think you're saying, is it possible to be malnourished by eating Ozempic, if you're just eating, French fries or nacho chips?
Right.
I mean, malnutrition in our society is pretty uncommon. So I think people need to be sure that they get vegetables, and some people could take a multivitamin and that sort of thing. No, we need to remember that having a healthy lifestyle comes first. There has been a lot of press items about complications from using drugs like Ozempic, and really they're very uncommon. So, physicians who prescribe it don't worry about hurting their patients. Now, I should add one other thing, Jill, that one of the concerns about marked weight loss, if you're losing more than 20 or 30 pounds, you're at risk of losing muscle. And the technical term for losing muscle is sarcopenia. So I think it's very important that anybody who's on a serious weight loss program needs to work on maintaining strength. So I would recommend, if you getting some home weights and working out at home with those, going on YouTube and finding some strengthening class videos, or joining a gym. So working on maintaining and perhaps even increasing strength is key to good health when one is losing weight.
Well, that is very good advice. Dr. Tom Elliott, we'll leave it there for today. Thank you so much for joining me.
Thanks a lot, Jill. Bye.
That is Dr. Tom Elliott, the medical director at BC Diabetes. Again, talking about the increased numbers with people just in BC, focusing on BC, people using Ozempic, up from about 41,000 people in 2021 to more than 113,000 as of this time in 2024. When we come back, we'll find out what